Hello, my name's Terry Rudd. I'm going to go demonstrate the use of putting in a urinary catheter in a female. Whenever you ask or you get an order for a urinary catheter for a patient, just remember that urinary catheters are the single most significant source of hospital-related sepsis, and as a result of that, you want to be absolutely sure that you're putting this in under sterile procedure, because we don't want to introduce bacteria into the bladder, which will then go to the ureters and the kidney and the blood. So from that perspective, I want you to notice that I've draped my patient. I've also put the bed at a comfortable level for me, and I happen to be right-handed, so I always like to be on the side of the bed where I can cath the person with my right hand in a convenient spot for me. So I intentionally place it that way. I have also brought myself an extra sterile catheter in case I contaminate, so I have my plan B with me. But in most catheter kits, the catheter kits actually come in the tray. This happens to be a Foley cath tray. Everything should be in here. And so I'm going to go ahead and open it up. Now, whenever you open up a sterile tray, you always want to open up away from you. Okay, you always want to open up away. So I'm going to take the tape off, and I'm going to put, and this is going to become my drape underneath, all right? So I'm going to open away. I'm going to do the two sides, and remember, anything on the outside or the edges is considered contaminated. So this last flap I'm going to grab like this. Now, in general, everything will be given to you in the order in which you need to use it. Now, there happens to be a drape here. Now, when I grab this drape for underneath, remember, edges are considered contaminated, correct? And I'm going to go ahead and put the shiny side down, because if I get moisture going there, and I'm not gonna mess with the middle at all, because that is going to be my sterile field. So I'm going to go ahead, and if the patient can lift their buttocks, I'm going to ask them to do that. If not, I might have somebody help me, or if I can get them lifted on my own, I will do that. So you'll notice in my box, the next thing that comes is a set of gloves, correct? So I'm going to grab the gloves in the middle so I'm not touching anything else with my hands. And I should mention I did wash my hands first, and I did explain the procedure to the patient, all right? So I open up the gloves, and then your first glove goes like this. You can touch the inside. Inside is considered contaminated, as are your hands. And I want you to notice I'm going to hold my gloves up high so that I don't accidentally get fingers hitting on something and contaminating it. Now, if you mess up like this, no issue, as long as you go sterile to sterile. Many of you with big hands will be glad to know these gloves are huge. The inside of this is still sterile, so I'm going to grab the inside and just get it out of my way. This happens to be another drape. It can be used. I sometimes find them a little clumsy to use, you know, and I personally prefer not to, because I don't like to have it fall down, but I will go ahead and attempt to use it today just for you, all right? But if it falls out of my way, I'm going to have trouble getting where I need to go. Now, what comes in this kit is a syringe in which I'm going to check my catheter balloon, betadine, which I'm going to use to moisten my swabs, and you want to be sure your patient is not allergic to betadine. Oh, this is very cool, this lubricating jelly. I've not seen it like this before. And then if you need a urine specimen, that's coming in. So I'm just going to take this entire upper tray and I'm going to set it aside for my use. Now, here's my catheter. I want to be absolutely sure that the balloon works on my catheter before I put the catheter in, because if I don't, and I put a catheter in with a broken balloon, what's the point, correct? So I'm going to make sure I inflate my balloon and make sure that it works, and it looks pretty good, yes? And I want you to notice that so far I've kept everything sterile, correct?
Yes.
And I'm going to leave the balloon inflated with the syringe attached. Okay?
You're going to leave the balloon inflated.
I mean, the balloon deflated.
Okay.
And now my catheter outside came here on my non-sterile field. Do you see what happened? But I'm still going to be able to salvage this, because what I'm going to do now is take the paper off, all right, and keep my catheter sterile. So I was able to salvage that. The catheter did not touch the bed. If the catheter had touched the bed, I would have had to have gotten another catheter, okay? So I salvaged that, all right? Alrighty, so I know my balloon works. I've got my syringe attached, correct? And then what I'm going to do is I'm going to open up my my lubricant, and I'm going to pour it in my tray so I can goop up my catheter. This is practice stuff that's been used, so I don't know. Oh, I did get lubricant, yay. And anything I'm done using, I just drop. I just drop. I then am going to open up my betadine. It says tear, pour here. I see it now. And I'm going to go ahead and pour it on my cotton balls. And then when I'm done with this, I'm just going to dump it. You see how I drop? I don't place, I just drop. So now what I'm going to do is I'm going to deem one hand sterile and one hand contaminated. I always use my dominant right hand as my sterile hand so I don't forget. Now this hand is going to become dirty because I have to hold up the labia. So what I'm going to do, there's this lovely drape that I adore. Okay, and it's in my way, so I'm getting rid of it. All right. So then what I do is I take my cotton swabs, and what you do is you clean away first. I don't want to stain the mannequin, so I'm just going to simulate it. So I lift up the labia, and I clean away, and I dump. See how the dump goes? I clean towards, and I dump. And then the last thing I clean is the middle, and hopefully when you do that, that little urethra is going to little wink at you. Now the mannequin, it's sitting there like a hole, so it's not hard to find, but I got to tell you, urethras are difficult to find. They really are. And I'll tell you too why I like having a Plan B catheter. So now I'm going to take my catheter and I'm really going to goop it up. And I'm going to let my patient know I want them to take some deep breaths in and out. And I want them to take deep breaths in and out to relax and also to distract them. It doesn't really hurt. It's a little uncomfortable. You know, but could you please just take some deep breaths in and out? I'm going to put a tube in, and it's going to be a little bit cold. It's going to feel a little bit cold as it goes in. And I've got my catheter gooped up, and I'm going to go ahead and insert the catheter until I see urine coming out of the tube.
Where do you insert it?
If I see urine inside the tube, I know I'm in the bladder. And then what I'm going to do is I'm going to inflate my syringe. You with me? And I'm going to disconnect it. Because then what I'm going to do is gently bring the catheter back, and the balloon will hold the catheter in place. I then will go ahead and hang my catheter on the bed. The urine will come into the catheter, and they've got some pretty cool things here. They've got a little hanger deal here, which is nice. And then what they also have, there's a hook there, which is even better. And then what they also have is they have this rubber band with a little clip, so that I can clip it on the patient's sheet so that the catheter isn't pulling on the urethra. And then afterwards I just might get a washcloth and clean it off a little bit, all right? And then basically my procedure's done. Usually when we put a catheter in, we like to get the first urine specimen. I can get the urine specimen from the bag because the bag is sterile, and I would get that with time, date, initials, patient name, and all the proper labeling. If the catheter's already been in for a while and I need a urine specimen, I can get it out of this port by cleaning it with alcohol and pulling up with a syringe. For my documentation, I would put that a 14 French Foley catheter was inserted to the bladder. I had a return of 240 milliliters of clear yellow urine, and that's basically the procedure. Thank you.